Yep, there we are.
Over there?
Yeah, we're there.
What's up, my
We're
man?
nothing much, brother. Just
Interesting.
long day, but I'm pretty sure everybody had the same thing too. Yeah, so, but how was your day, brother?
It's all right. Busy as usual. Busy as usual. Trying to get everything situated here. Yeah, it was just it was a long day. It was a long day, but it was a fun day, I guess. Exciting day. A lot of things happening in the COVID world. A lot of things happening. It's just an interesting day. Happy Hump Day, everybody. Hump Day Wednesday. Aloha, aloha. We got a special show tonight. We get a special show every time we're on, but tonight we got Dr. Lee Evslin and Dr. Lee Altenberg, two medical professionals who's going to come up and share their insights with what's going on. It's a little bizarre, Charlie, what's going on right now. Oh yeah, bingo, bingo. Share, guys. Let's get everybody watching. Share, share, share. So there's been just a lot of developments. Every time you turn your head, there's a new story. Um, Kids getting vaccinated. Pfizer saying it's all 100% effective. You got Maui is blowing up. Clusters in the church that has now expanded into schools and workplaces. You got visitors coming in by the droves. Rental cars selling out. Beaches are covered with tourists. Roads are covered with tourists, and numbers are climbing. And again, we get warned to ease up on the gatherings. We, the local residents, try not to gather, be patient. Um, I'll share a little bit more once we have the doctors on. There's Dr. Altenberg, man. He's early, but yeah, there's a couple of interesting things that I wanted to discuss with the doctors tonight. But Charlie, it's going back to the mixed messages that just does not stop from our leadership at the state level. Doesn't
Hmm.
stop. Keeps on going.
Hmm.
Keeps on going.
Yep. Well, today I did put out I did do a post where I cut and paste a statement that was released by Dr. Sarah Kemble, the acting state epidemiologist, right?
Mhm.
Because the question was, why was the name of the church revealed? And she says that if basically what she said is that if it's a serious matter, that they will reveal it. Well, that just goes counter to what they said earlier with HIPAA. And I thought that every case is a danger to the community because it can spread, right?
Yeah.
So the release, so I said, gee, so you're very selective of what cases you release and what you don't. So I said, so that HIPAA excuse went completely out the window by what they did. So that's why more so now I don't have the confidence. And I said, well, you guys are the ones that said we can't release the information of where the cluster is at or what location it's at because it involves HIPAA. Well, guess what? You dropped the bomb on King's Cathedral, and there went your HIPAA theory. And like we said all along, you can state the location. We're just not asking you the name. Because I thought HIPAA applied to privacy of an individual, not a location. And so it made things just, it just made things just, so confusing. And well, I say confusing, but that's just a prime example of what we've been dealing with. You know, we always talk about the yin and the yang, right? If the yin and the yang is cultivated properly, a lot of things can get done. But when you get yin and yang and no yang, then that's when everything just gets all gets all screwed up. So
It's called hypocritical, Charlie, because
yeah,
early on, you called it out early on about the HIPAA. I raised the example of the shark attacks, but the shark bites. But you know, we were told all along HIPAA, HIPAA, HIPAA. It's a violation of HIPAA. We knew, we said it wasn't. We called it out that it wasn't because the fact, the information that you are providing does not identify a person is not a violation of HIPAA. I don't care what anybody say. That's just what the law says. You cannot provide information that's going to cause a reasonable person to identify the person that is affected. That's how the law is written. So they're full of crap. Remember when they posted the bus route in
mhm.
Honolulu? City bus was the first one, right? Or maybe the bar was the first one. But city bus, they gave you the route number, the times. If you ride the bus, you know exactly who the driver was. Because these drivers don't change. You get to know the bus driver. So if anything, that was the HIPAA violation. Because a reasonable person that rides that bus, that route every day, can figure out who that person is. But it was hogwash. It was hogwash. Um, it's so crap. And then now all of a sudden, well, if we believe it's for the safety of the public, then we're going to release it. Like you said,
that
Charlie,
that's
all of these
another
cases
that's another contradictory statement. If it's for the safety of the public, then you should release it every time.
every time.
So if John Q. Public was at Kenny's Burger House on a certain date, and you release information that there was an infection in the vicinity of Kenny's Burger House, wouldn't individuals kind of tell themselves, you know what, I haven't been feeling good. I was at Kenny's Burger House. You think I should go? And I think I get good grounds to go in and go get tested. So aren't you getting to the root cause or trying to find a common denominator? And that's how the community can help the state in combating this spread. But when you folks are doing on Jeopardy, where answer the question right, you'll jam up. People just going go off half cock, trying to figure out what the hell going on, and they probably won't get the right answer because you're keeping it away from them. That's what I was talking about.
Yeah. No, you're right. And hey, guys, for those of you that just came on, don't forget share. We got Dr. Lee Altenberg and Dr. Lee Evslin coming on tonight to share their
Mhm.
insights. We want to get the word out to as many people as possible. A lot of contradictions going on. A lot of conflicting statements between the governor and the lieutenant governor. Now everybody's concerned. All of a sudden, oh, we're all concerned. I'm concerned about the spikes. You know, they should listen to the Mel and Charlie show. They should listen to our guests who are experts in the field, and then flap the lips. These guys are flapping the lips after everyone, all the experts throughout the world are suggesting and recommending. In fact, last week I talked about the CDC lady begging states not to lessen restrictions, begging. She went off script. I feel for that lady. She said, I'm going to go off script because my heart is telling me I need to tell the people to please, please, please. She begged and begged and begged. But no, we're moving right along. Now all of a sudden, oh, we're concerned about the recent spikes. What the hell did you guys think was going to happen? Now, ooh, I'm concerned. Maui, but now, Mike Victorino, Mayor Victorino is saying, I want a second test upon arrival. What is the governor going to do? Is he going to reject them like he did Derek, our mayor on Kauai? Right? Everybody now is starting to understand, Charlie, what we've been saying for months, not just we, but our guests have been saying for probably half a year now, maybe longer. Now these people are starting to realize, maybe we should get a second test. Duh. In
No,
the
but you remember
meantime,
what the problem was about the second test? Yeah, the second test, but I will not let you charge the visitor coming to the state.
yeah,
I will not let you charge them. I mean, that should have been, and we've said this from before. When you fight a pandemic, you don't fight it with politics. You don't fight a pandemic with politics. And the problem was political intervention got the best of it that caused this. Now, if there's somebody out there that can prove me wrong, then do it. And I'll shut up about it. But I firmly believe politics got interjected and bam, we have this problem.
Yeah, the politics was infused in this from the beginning. The statute, as it's written, or the emergency proclamation, as it's written, says that if the county can do a second test, but they got to pay for it. The county has to pay for it. Why are the taxpayers going to pay for a visitor's test if they want to come here? No, you pay that test, guys, or you go to quarantine. It's that simple. And even then, the test upon arrival while it's still better than what we have now, it still allows a lot of people to come through. Just again, remember what Dr. Dworkin said. The real world scenario, the real world trial is Kauai. October 15th, 2020. We enter safe travels. Our case count goes through the roof. A month later, we opt out. Our case goes back to zero. How many more examples do you need? We know what the problem is. Guess what the problem is, Charlie? The unsafe travels program. That's the problem. It's not a safe travels program. Now today, I'm going to hang on to that because I want the doctors to chime in on this. What was said today about Maui's test. The lieutenant governor completely discredits the Maui's test, which validated the Kauai discussion group, which Dr. Evslin was on, and maybe even Dr. Altenberg. I'm not sure. I don't remember him being on there, but the Kauai discussion group came up and said 7 in 1,000, at least 7 in 1,000. The Maui test validates that.
Mm-hmm.
And the lieutenant governor says it was inconsequential, the number. What did they have? They just had 2 cases. I mean, like, this guy is pissing me off. I'm gonna tell you, man, this guy is pissing me off, and I really don't know how much more I can take. I watch this guy on TV every single damn day. He does the segment where he preaches, and then he comes right back and does the question and answer. Everything he says is how wonderful everything is working. Our case counts are low. Our hospitals are empty. Our exposure rates or positive rates are low. Who the hell is telling him this stuff? I mean, is he that far off track? And then he discredits a study that was done by experts, real world study with real world passengers leaving the state. And he has the nerve to come on and say that was inconsequential. Wow. Sorry, LG. You are off track, off base, and your messages are harmful. Your messages are harmful. Anyway, let's bring in Dr. Altenberg. Sorry for the rant, but I'm sick of it, man. I'm so irritated. Now we got to put on the happy face.
Just don't let it get to you.
We put on the happy face now.
Just don't let it get to you. Yeah, there he is.
There he is, Dr. Altenberg.
Aloha.
How are you?
Fine, thank you.
Good to have you.
I got to say, Doc, I am actually so happy to have you on the show. I mean, we've seen you on so many different other Zoom calls and presentations, and I'm just honored to have you on tonight. Obviously, I'm Mel. The Hawaiian is Charlie. Welcome to the Mel and Charlie show.
Well, I'm honored to be on. I hope it can make some sense.
Well, we'll have some fun tonight. Dr. Evslin should be joining us in a little bit. I know everyone wanted to come on, but they wanted someone else to be on with them. But Doc, might be just you and the 2 of us, guy.
Okay.
Might be just you and the 2 of us. Well, first of all, while we're waiting for Dr. Evslin, why don't you share with our viewers who you are? You're an amazing, accomplished guy. You can share a couple. What do you do, Doc? And where are you from? And what do you do?
Okay, so I grew up in California, and I'm a scientist, and my main area of study is evolution. And I make mathematical models of evolution, and they involve intricacies of exponential growth, of species multiplying and dying, going extinct, and the genes doing that, and microbes doing that. So the mathematics is able to actually embrace all of these different forms of life. So I'm at the University of Hawaii in the mathematics department and the information and computer sciences department. And I'm on the graduate faculty of the ecology, evolution, and conservation biology specialization.
I gotta ask, Charlie, I gotta ask,
Mm-hmm.
at what point in your life do you wake
Yes.
up and say, I want to be a scientist studying evolution?
Well,
When does that happen?
I tell you, from an early on, I wanted to be an astronaut, and my parents was very happy because throughout my entire childhood and going through high school, I didn't get good grades, but I took up space in school. I took a lot of space.
So, Doc, I mean, how did it begin, man? I mean, were you just always amazed and curious about evolution, or? And I'm gonna bring in Dr. Evslin, but go ahead and continue.
Well, so I knew I was going to be a scientist when I was like 7. So, but it wasn't until I was a junior at UC Berkeley that I decided evolutionary theory is what I want to do, and that's what I've been doing ever since.
Nice. Well, welcome again, and thank you so much for joining us.
But
Yes.
I should add that I lived on Maui for 19 years,
Oh,
down in Kihei.
Kihei.
Yeah.
Well, no wonder you look familiar because I retired from the Maui Police Department, and I thought I saw you speeding a couple of times, but I don't think that was you though. But it's a beautiful place now, but sad to say it's getting really congested now, really congested. So I guess that's the part that, when you got a beautiful place, people want to flock there, right? They want to go there. So.
And I should
How
mention
you
that
doing, Doc?
the background image is Ilima, is 8-foot high Ilima from Wailea 670 in South Maui. Okay.
Wow.
My background is cedar. What's up, Dr. Evslin? Welcome back, buddy.
Hi, how are you guys doing?
All right, all right. So, Doc, I mean, if you could briefly introduce yourself to our viewers, we got some new people. And guys, as we go on share, hit the share button now. I mean, guys, these are experts in the field, and we want to get the word out. So, Doc, tell us a little bit about yourself, sir.
So I'm Lee Evslin. I'm a physician from the island of Kauai. I moved here in 1979 with 2 little kids, and now I have 4 adult kids and 9 grandchildren, all running around the island one way or another. And as a pediatrician at Kauai Medical Clinic, Kauai Medical Group, and I became CEO of Kauai Medical Clinic for maybe 15 years. I was CEO of Wilcox Hospital for a few years. My last final years, I actually had a small private practice in Kapa'a that I just loved. It was a great little practice that I did mostly wellness, pediatrics and wellness of all ages. And I retired back in 2014.
Well, welcome back to the show. Full disclosure, Doc was my son's pediatrician way back. He's almost 30 years old now. My gosh, how time flies. So welcome to the both of you guys. I got to tell you, well, obviously we did share some emails. We saw some emails going around. I did want to bring on a panel of medical experts, not politicians, just medical experts, to share insights about what you guys are seeing going on here in Hawaii. A lot of the discussion right now as it relates to the vaccines, to the variants, to the passport, to the spikes in cases, all of this stuff. We're going to try to cover as much as we can in 1 hour. So let's just start maybe by, and I'm going to let Dr. Lee, I cannot say Dr. Lee because we got 2 Dr. Lees. Dr. Altenberg, we're gonna, he's the rookie of the show, so he can go first. Doc, what's your observations right now as far as what's happening here on Kauai?
Hawaii.
In Hawaii. Sorry, Hawaii.
Well, I mean, the state has done really well in keeping the infections, the coronavirus infections low. And that can largely be credited to all the citizens being careful and the level of mask wearing, and just being careful not to be in contact with lots of other people. So, in fact, in January, the cases were dropping so fast that basically every infected person was only infecting like 0.87 other people. And if that had kept up, the coronavirus numbers would just keep going down and down and down and down. Now, the problem is that we've been inundated by all these coronavirus variants that are, they're evolving all around the world, and they're transporting by airline, and they're taking root and exploding in various communities. And so all of them except one, which is actually the most dangerous, the P1 variant from Brazil, all of them have gotten here. And all of them, none of them were even detected before the Safe Travels program came into effect on October 15th. So all of them have gotten here somehow, even though the test was supposed to keep them out. They've gotten here through, penetrated the Safe Travels pre-travel test. And so here they are. And the California variant, the B1.429, has already dominated the cases on Maui. So it looks like it got there first and started spreading, and it's 20% more infective than the good old-fashioned coronavirus variants. So that means if the people of Maui are being conscientious enough to keep the reproduction number of the virus below 1, but then it gets multiplied by 1.2 by 20%, now it's above 1. And now it starts to grow exponentially. And this may be in part accounting for why you've had the explosion on Maui. Now, the good news is that the vaccination is going to lower that reproduction number, because it's taking away the possible hosts that the virus can infect. And the vaccines seem to be very effective, really, really effective. 90% reduction in transmission and in sickness. So, so that's really good news. The bad news is that exponential growth of the virus can outstrip the linear delivery of the vaccine that we're getting. Now, we're getting increased supplies of the vaccine, so that's good. But whether the vaccines are going to beat the growth of the variants is impossible to say right now. And right now in Hawaii, the doubling time of cases through March has been about 19 days. It means every 19 days, there's twice as many more cases than there were 19 days before. Now, if that keeps up, we're due for another outbreak. So the thing is, the population, if people really bear down and get extremely careful, I think we can stop the transmission. But under the efforts that we've been doing as a population up to now, that's not enough to stop the UK variant, which is 50% more transmissible. And if the P1 variant gets here, that's 1.5 to 2.5 times as transmissible. That's explosive, and it's exploding in Brazil, and it's overwhelming the healthcare system there. And so whether we will get enough vaccinations in time, if it got here anytime soon, that's a toss-up.
Let me ask you something there, Doc. Given what you've just explained, really, given the recent news that, the Lieutenant Governor wants to open up more inter-island travel. So given that, I guess where I'm heading with this is the discipline by some of the people of Hawaii. So if we know that we have this outbreak that's occurring now, and people just don't want to be disciplined enough not to travel, then whether or not they're vaccinated, because a lot of things that the Lieutenant Governor said is based upon people being vaccinated. Well, we know not everybody's vaccinated yet, and the population base is pretty fluid and transit, right? You got people coming and going all the time. So whether you get to that number, that whatever formula that you use to say, hey, we've overcome this thing, unless we reach that number, the layperson like myself, I don't know what that number is. Is it attainable to get to that number? And whether we can do it right? That's my question.
Well, when I look at the numbers that Hawaii had during the 2 lockdowns, okay,
Mhm.
they were able to get the reproduction number down to about 0.6. That means every 10 people that had infections infected only 6. And those 6 infected only 4, et cetera, et cetera. So that, I think that shows what the population is capable of. So, but if you multiply 0.6 times 2.5, that's what the Brazilian variant could do.
Mhm.
That's bigger than 1. That's a lot bigger than 1. And so even on our best efforts, they might not be able to overcome that variant. The UK variant, if we went back to lockdown level precautions, that I think would stop it. And when you combine that with the vaccination, but in other words, what everybody has been doing, it gets that much harder to do to stop the variants when these variants are getting here, and they're all there doesn't seem to be any barrier to the variants getting here under the Safe Travels program.
Yeah, and I think that's kind of the concern. And what was and I'll get to you, Dr. Evslin, real quick for your insights. But to, this morning, if you watch the morning news, you see the lieutenant governor talking about the opening up travel with just the immunization or the vaccinations. This evening news, the Governor Ige is saying while they're working towards that, he doesn't see that happening probably till the end of the year. Where the lieutenant governor is saying he's hoping we can get to that by the middle of May. So I think there's some mixed messages coming from the state leadership as far as what's going on. As we read the newspapers, as we see what's going on in Brazil, we just read today that Washington State now they have 100 cases of people that contracted the virus well after their 2-week period after their second shot or their second vaccination. I think Idaho had similar, not similar, I think they had 25 or 30 cases. I think we'll see more of that. What's the future? I mean, if we start opening up, more people will come. I know Dr. Evslin, this is for you because we on next Monday we enter Safe Travels, and you very familiar with our medical capacity here. What's your take on all of that as far as allowing more visitors to come in with the potential of this replicating variants that Dr. Altenberg just talked about?
Yeah, on the one hand, I completely understand, in my mind anyway, the position that Dr. Berriman and the mayor were in 6-8 weeks ago when they made the decision that April 5th could be the date, because all the cases were going down, the vaccination efforts were going well. It looked like Hawaii was doing pretty well, essentially, with the numbers dropping too quite a bit. And then I'd have to say, in the last 2 weeks anyway, I've been having my concerns, that my apprehensions have been growing. It is a true race between the variants and vaccinations. On Kauai, we're vaccinating well. I think we vaccinated 40,000 people, and I figure we have about 58,000 adults. So we've done almost whatever that is, almost 2/3 of the adults, which is pretty impressive. So, and one of the reasons why I think we were so good is that we didn't have to deal with illness. So we could put our efforts, hospital efforts, the Department of Health efforts, and whatever into vaccinating. So our vaccination here has been great. Our contact tracing has been good. And as I said, I was feeling apprehensive about April 5th. I wished it was May 5th, but I was thinking, maybe it's going to work. And now I'm more nervous. Monday's news, 3 news items came up all at once on Monday. One was the head of the CDC going live and saying that she has this feeling of doom, essentially, that she's extremely worried that the variants are going to outrace the vaccination efforts across the country. She's talking about, obviously. Today, there were also measurements on Monday, which were interesting. It showed that Hawaii's increase in hospitalization rate per capita, as a percentage of the population, was the highest in the nation. Now, it's not that we have so many in the hospital, it's just that our rate of increase was the highest in the nation. And I think that the other statistics that was in that Monday article was that our rate of increase in the state as a per capita measure, I think we were 13th highest in the nation in terms of increase. Lots of states are going down, but states are going up, and we're one of the states that's gone from 40 to 60 a day up to triple digits over the past week, which is all kind of alarming. And then I saw Dr. Pang's study out of Maui, which I think you guys have talked about. But when we had done an analysis a long time ago about the number of people tourists that could come in on a safe travels program that would be infected but not detected by a single test, we had estimated that number would be 7 per 1,000. This doctor group we've been part of, and that's what the numbers on Kauai showed when we did the testing. They actually were more than that. They were even between 7 and 15 per 1,000. Dr. Pang did this study of tourists leaving the island of Maui, and they were doing them as they left to try to kind of see what they would find, and they found the same 7 per 1,000. And then the Lancet study came out, which I think Dr. Altenberg is going to talk about, but the Lancet study said the same thing, even worse. It said a safe travels program with a single test is going to only detect 36% of those people who are infected. And that's even lower than we thought. We actually thought that the test would only miss 36%, not only find 36%. And what was disconcerting is on the state level, Dr. Green and maybe others have only quoted another part of that study, which showed that on the day of travel, your chance of getting infected in the airplane was 88% reduced by a single test prior to getting on the plane. But they actually made 2 points in that Lancet article. They said, yes, you're going to be safer on the plane because of this pre-travel test that you did 2 or 3 days before you traveled. But overall, the effect that you'll have on the place that you travel to, you are there's a good chance that you could infect people there because you've been missed. In other words, because you get tested too early in the disease for it to get picked up by that first test, and then your test would become positive when you're in your destination. So those things on Monday, the Lancet study, the feeling of doom that the head of the CDC is expressing, and the numbers coming out of Hawaii, all made my sense of apprehension jump. I'm not sure, I'd hate to be in the mayor or Dr. Berriman's position right at this moment where the opening and so much is going into the opening in a few days. I wish there was a way for it to be May 5th. I think the best we can do is aggressively continue the immunization process and do testing. And I know that they're putting big efforts into getting post-travel testing done. And just like before, if we see those numbers are bad, maybe we can react quickly and shut down again and get some more vaccinations in arms. So it's a long response to your question.
Oh, no, thank you. I think I appreciate that. I know Dr. Altenberg has been a part of many studies or analyses over the last several months. The Lancet study, Dr. Altenberg, are you prepared to talk about that?
Yeah, so this just came out the Monday before last in the journal Lancet Infectious Diseases. And it's by authors from Stanford, UC San Francisco, and Harvard University, and the University College London. And they basically, it's very difficult to get empirical tests of how many people are getting through these testing regimes. And so what they did was they took all the information they could gather about the disease course once somebody's infected, the sensitivity and the specificity of the coronavirus tests, and they put it into computer simulations to see how 5 different kinds of travel regimes would fare. And so when they put the one that Safe Travels program is adopting, which is one PCR test in the nose within 3 days of travel, when they put that in there, the result is that it reduces the people that are infectious on the plane by 88%, which is terrific news for the airlines. But then there's lots of people that were not detected that once they get to their destination, Hawaii or Maui or Honolulu or Big Island or all the Hawaiian Islands, they continue. That's when they become infectious. And so the pretest was only picking out 36% of those people that would become infectious once they arrived in their destination. And so 36%. If there was a vaccine that came out and everybody had been taking it since October 15th, and then they announced that it was 36% effective, I think there'd be an uproar. And that's exactly what this study shows for the Safe Travels program. It's only 36% effective. That means we're getting 64% of the exposure that we would get with zero pre-testing, with zero quarantine. So what's surprising is how little press this article has gotten, both locally and nationally. I mean, well, it's really of international consequence. So I think this needs to be much more thoroughly understood. Now, the KHON2 did a story on it, where they interviewed Lieutenant Governor Dr. Green, and the headline was that this study says the pre-travel test finds 90% of people with the vaccine, 90% of people with the coronavirus. What it's finding is 90% of the people who are would be infected on the plane and stops them from getting on the plane, but it doesn't talk about this story on KHON doesn't talk about what happens after, what happens when they get to the destination. So now the Lancet study went on to also examine what Kauai's program would be doing. So to be specific, a pre-travel test followed by 5 days of quarantine and then a second test to get out of quarantine. And they found that protocol was 70% effective in reducing exposure of the population to infected travelers. So, so everybody, every policymaker should be aware of the results of this study. Now, this is a computational study, so it's basically trying to guess at data that nobody has. And I think the take-home message is we should try to get as much of that data as we can. They should resume the departure study that Dr. Pang and company did on Maui. And the brilliance of that design is, so I mean, the problem is you land in Hawaii, do you want to take a test that's going to ruin your vacation? No. So that's a huge disincentive that skews the results of any kind of test you're going to get unless it's a mandatory second test. So the brilliance of the departure study was that they tested people as they were leaving the state. And they said we're only going to report the results to you. We're not going to tattle on you to anybody else. And so they got 77% participation. So the surveillance test that was done at the outset of the Safe Travels program, they only got 1% of travelers participating. In this departure study, because people weren't afraid it was going to ruin their vacation, they got over 70%. So I think this study needs to be repeated to get an idea of how much this computational study in the Lancet is actually playing out here in Hawaii.
Well,
Now, I have a real quick. You know, the Lancet study, they talked about the PCR test in the nose. In Hawaii, one of our safe travel partners, Hawaiian Airlines, has contracted with Vault, and they do a saliva test, not a PCR test in the nose. Is that an issue? I know we've spoken to many experts that have concerns about those tests that are either self-administered or not a nasal swab. Should we be concerned about that?
Well, an interesting thing is this Lancet study also plugged in what happens if you just do an antigen quick test at the airport. How protective is that? And they found that is 32%. So it's not much worse than the PCR test. It's still not great as a do it alone test. And here's the interesting thing: they found if you didn't do any pretest, if you didn't do any quarantine, but just took a test 5 days after arrival, a PCR test, that would actually be more effective than the Safe Travels protocol. That would reduce exposures by 42%. So this is, these are surprising things. So this is why you do computer models, because you can't just intuit these results. But the most effective, actually, if they did they looked at what happens if you do a quick test, antigen quick test at the airport on the day of departure, and that reduced the exposure on the airplane by about 80%. And then you followed that by a quarantine and a second test, and that reduced the total of exposure to about, I think, 63%, if I recall correctly. So there's not much of an advantage of doing the PCR test versus the antigen quick test on the day of travel. So I don't know about the other varieties of the tests that you were asking about, but at least for those two tests, they're not much different.
I think, and this is directed to both of you Lees, Dr. Lees, Altenberg and Evslin. But it seems, and we've been monitoring on social media what people think about statements released by our administration, because that seems to get the most traction. They get on a syndicated news station like KHON, right? It's when I say syndicated, meaning it's broadly watched throughout the entire state. And a statement is made in such a way that those who've been doing this for the last year and so many months, we're kind of scratching our head saying, wait, we had some experts on there. That's not what they said. But yet we know what the administration said. So now I can see a lot of contamination going on with lay people who may not know any better, but that's really wanting to look for that promised land because they've been cooped up all this time. So that's when everybody starts to, let their guard down. They start being complacent because, hey, the LG said this. When we know, and a prime example is what he said about that Lancet test. If you were there just to listen to it, it'd be pretty impressive. But yet, people such as yourself, Dr. Altenberg, and many others, they start to pick up, wait, the numbers are, he's playing with the numbers again. And so people like us, we need that explanation, but as that time goes by, it's just time wasted when we should be trying to pick it up on the front end. What do you folks think about that? The messaging, until he can get the message right, I personally believe he should just hold off in making those kind of statements because it throws everything off. But, who am I to say that? That's just been my observation.
Yeah, I certainly agree with that. Particularly that one. That was so incorrect. Well, I mean, it was correct in that it keyed in on a single part of the study, which was you do have an 88% decrease in infectivity on the airplane, and that's great. But it missed this whole other part, which is really important for us, is that the decrease of infectiveness of the people arriving during their whole stay is only 36% decrease, and that makes us apprehensive in terms of the variants. If the variants hadn't jumped into the scene, we would have won, it looked like, basically. I mean, with the immunization rate and the declining rates across the country, things really looked good, but the variants really make a race. And we have a head start on Kauai, because we're starting with low numbers and we're doing so well with vaccinations. But in my mind, the month makes me apprehensive in terms of just, if we can watch closely enough and respond quickly, and which brings us to one other point, that the House of Representatives is trying to pass a bill essentially that takes emergency powers away from the governor and the mayors and puts them in the hand of the legislative body. It was dropped by the Senate, but the House is trying to keep it alive in other fashions. And that's a terrible idea. I mean, the one thing that you need to do with things like variants is be able to be nimble. And if you can't, could you imagine if they're going to debate this on the floor of the House and the Senate, what their next step is? And just, in a cautionary tale, Chile, for example, Chile, there was an article that I think came out today about Chile. They were doing great in South America, less numbers than other countries, and their immunization rate was among the highest in South America. I think in their summer, which was January, they were January and early February, they were something like 27% or 30% immunized, which was real high. They were leading South America in terms of immunization. And so they relaxed for the summer. They said, okay, we're there. And our state, by the way, is the same percentage immunized that Chile was when this fell apart in Chile. I think statewide, we're about 30% people have a single shot. And I think maybe Lee has another number for that, or you guys. Anyway, Chile relaxed for the summer because they were doing great and their immunization numbers were leading to South America. And they're having a huge surge right now. Their ICU beds are coming to capacity right out of the blue. And it was basically because they took the summer to have fun. So again, I mean, we're always kind of the worry warts. I was trying so hard 2 weeks ago not to be feeling good about everything. But I do think this month is going to be such a crucial month. And I think efforts to immunize, I hope there's enough vaccines around. I mean, we should just finish immunizing adults and then start on the kids on the island.
Well, one last question or one last comment is, I would love to get everybody immunized, but as long as there's mistakes made where people leave doors open, let the vaccine waste, and you got to throw away so many vaccines. I don't know, how long more we can have of that, because there's always, at this point, everybody's trying to get vaccine. Now, what are your thoughts, Dr. Altenberg, about, you've done the numbers, and it definitely seems you follow this as part of your profession. What can you tell the people of Hawaii right now, just based on the numbers that you see right now? And I hope it's good news. Do you think good news is around the corner, or something drastically has to happen to kind of throw this thing off kilter to get it back on the rails?
Boy, prediction is hard, especially about the future,
Right.
as Yogi Berra said. But watch tomorrow's case numbers.
Mm-hmm.
So there's a daily cycle, a day of the week cycle in the number of cases that are reported. And so Thursday is about 20% higher than Wednesday typically. And so I would expect a new peak tomorrow. So look at the numbers and see what happens. And if the rate of increase that we've been doing throughout March keeps up, we could have 150 cases tomorrow. So, with all the exhortations from the Hawaii leadership, maybe people are starting to be more careful even than they have been. Mm-hmm. But that remains to be seen. So what makes it hard to predict is whether the variants are going to beat the vaccines depends really sensitively on their reproduction number, on how many people a single person infects. Incredibly sensitive. So even going from like 50% more transmissible to 55% more transmissible can get us to peaks from 200 to 500 cases a day by the midsummer. All right, that's the UK variant. So it's really sensitive. So that makes it hard to predict. And because what people getting infected, basically it's subject to human will and human choices. We can choose a different future. It's just that everything gets harder when you're trying to stop one of these variants than the old coronaviruses. And so I would say watch the numbers over the next 2 weeks. And because if the current trend from March continues, we're going to see in the next 3 weeks numbers reaching 200. So let's hope that that trend doesn't continue, we can pull it down. So it's a combination of kind of this this animal pressure of the virus versus human will and human choices of human decisions. But what we really depend on the leadership to give it to us straight. And I just see a pattern of minimization. So I remember the first cases detected in Hawaii was a couple traveling from Asia. Was it Japan? I think it was Japan, and they were on Maui, and then they were on Oahu, and that's where they tested positive, or they had symptoms, and so they got tested and it was positive, and the chief epidemiologist said there's no added risk to Maui because they were asymptomatic. Well, at that time, there was already concern in the literature that this thing could be transmitted asymptomatically. And so if the epidemiologist had given us the straight story, they would have said there could be a risk, we don't know yet. But the answer was there's no added risk, and that was wrong. And that that person is no longer in that position. So it's good to see the system responding. I mean, there was a lot of other problems besides that came up with the contact tracing program, but at least, the system responded there. And that made me optimistic about Hawaii as a system responding to this. But recently, these false statements coming out of the lieutenant governor about the safe travels program. I mean, the statement, there have been no cases of consequence. Well, every one of the B1.429, the California variant, every one of those cases on Maui was somebody who got through the safe travels program. You strip away all of those cases, which are now something like 70% of the cases on Maui. If we'd had what Kauai was doing, none of those cases would have happened. And so are we to say that all of those cases on Maui are of no consequence? Well, that seems to be completely absurd. So there would have to be a very narrow definition of what's of consequence that is not simply including some people dying, but some minimal number of people dying for it to be of consequence. And I don't think that's a proper definition.
I think the minimization, and I've been saying this for quite a while now, it's what frustrates me, because if you listen to the lieutenant governor every morning like I do, because that's the station we listen to, I don't know why I punish myself, but it's very rosy and it's very promising, although we still got to wear our masks and do our part. I understand that part, but so much is not being said. But when you listen to the other leaders, whether it's CDC, the expert or the director who came out and went off script because she had to listen to her heart and beg leaders to stop lessening restrictions, or the governor coming out and saying, hey, if we continue to spike, we're going to have to cut back and close down again. I think the minimization is dangerous. Dr. Dworkin was on our show last week, and he made it very clear. You could talk about the testing on Maui. You could talk about the testing that was done by the Kauai group or the analysis. The proof is in the pudding. Real world scenario was Kauai, October 15, entered safe travels. Numbers went through the roof, opted out of safe travels, cases dropped down. There's no better proof than that the fact that Kauai had that quarantine requirement and a second test. Our reporting on our island, Doc, I know Dr. Evslin, you know this, and maybe Dr. Lee, or Dr. O, maybe you know as well. We report, our leadership on Kauai reports our cases real time. And to give the specifics as far as today, we had 2 more cases, local residents contracted by inter-island travel. The other day, we had 2 more cases contracted by testing out of the bubble. So we have a good idea here on Kauai. The bottom line is this: vast majority of the cases on Kauai is travel related. So my concern is Dr. Evslin, what's your, I know you kind of spoke of it a little earlier, but Monday we open up again. At what point do we say, hey, time out, enough is enough? And what do we wait for?
Yeah, the numbers, the contrast between Maui and Kauai since the time that we left the Safe Travels program is so indicative of the unsafety of the Safe Travels program. Maui, I think a week ago, their rate per 100,000 population was something like 220. Is that Dr. Altenberg? I think that was what it was.
What was that?
Over
That was over 14 days. In the past week, it's been about 44 cases per day per 100,000 on Maui.
So rapidly in your head, 14 times 44.
That's even higher.
Yeah. So here's Kauai running 5 or 6 per 100,000, I think, during that time per 14 days. This is Seattle, which was an epicenter of disease, was running around 86 per 100,000 per 14 days. This was about 10 days ago, I think. And Maui was running at that time 220 per 100,000 for 14-day time period. These are new cases. So that's, the difference between what happened to Maui and what happened to Kauai is astounding in a certain way. Not astounding, but staggering. It was and it's not talked about by the state administration, which keeps praising itself for how well this is done. Basically, all we've heard from the state is that we need to get Kauai to toe the line and do whatever the rest are doing and go to the Safe Travels program. Anyway, I'm very thankful that we had this reprieve for this time period. And as I said in the beginning, I terrifically sympathize with the position the mayor and the Department of Health were in making this decision several weeks ago when all the numbers were coming down. And there was so much pressure to open, and it seemed like the argument against opening was difficult to make. But we're going to need to watch closely. There is some good news out there in terms of immunizations. Was the other story on Monday, which we could go into a little bit if you want to do it as a next topic.
Yeah, I actually wanted to, before we wrap it up, I wanted to have both of you have your opportunity to share. There's some people on our show right now that are on the fence about taking the vaccine. So maybe we can get to that right before we head out. But I think it's important that we get as many people vaccinated as possible.
Did you want to cover that now or later? I missed that.
I don't know, Charlie, did you have another question? I know I saw you, looked like you had another question.
No, it's just that I'm just fascinated because number one, I can't count in my head. Number two, I'm not fast on a calculator, but I'm just fascinated by the way Dr. Altenberg can figure these things out, because we see those numbers coming. And, like I said before, when the pre-test came, the 72-hour came, all it tells me is that at that moment in time, that's when they were negative. Now, unless the person quarantines themselves before getting on the plane, anything happens 72 hours from the time they leave their home all the way to the time they get to the airport. They can pick up anything anywhere along the way. So sometimes 2-3 days after arrival, you're not going to see anything surfacing. But yeah, you give it, if people stay a little bit longer, you'll see it on the 5th, 6th, or 7th day. And again, that's always been a fear. We had Angela on, right? She knows what Queens and Queens West, they're rerouting. There's just no more room. And yet somebody is saying, from the administration, oh, we have plenty room. Well, that doesn't seem to be the case. So, it just leaves one to wonder, because there'll be a point in time when you have noted experts like these two that's joining us tonight. If you have a story being given by the administration that kind of countermands what all the other experts are saying, I just want to know what makes him say what he says, and he doubles down on what he says, and he keeps on going that route. Despite, we've had Jerome Kim, we've got these two gentlemen, we've got everybody that just deals with this day in and day out. And yet here we have someone that's just going down this path that's just rolling the dice every single time. And it kind of like we live in a hurricane state, but you don't need to go over there and whip up the winds. If we're going on hurricane, it's going to come, but just don't go over there and go stir up the environment and whip up the winds. And I think that's my fear. That's my point on this whole thing.
And the other point, it's not only catching the virus after your test, but the fact is that in the first 4 to 6 days that you have the virus, your test is going to be negative. So anybody that's tested in those first 4 to 6 days is going to have a negative test, and then it's going to become positive. So all of these people that are getting tested at 72 hours, if they're in the first third of their illness, they're going to have a negative test. And that's what makes it such a weak way to, screen your population.
I guess one take-home message I'd like people to have is there was one in the town hall meeting number 2 that Representative Kelly King gave, or it was a Maui Council member Kelly King gave, that the Lieutenant Governor spoke on. He said that if the whole state had the program like Hawaii, he said we'd die. And that once you shut down conversation about alternatives, different alternatives of quarantine and testing, you can no longer explore them and try to optimize them. So I think there's one idea out of Kara Flores of Hale, Hawaii, which I think is brilliant, which is that when people arrive, they're quarantined to the outdoors. Okay, because outdoors, your rate of transmission is something like 1/20th of what it is indoors. And that, and the reason people come to Hawaii is to be in the outdoors. So basically the quarantine would just keep new arrivals outside of indoor spaces until they get a second test. That could have minimal impact on the rate of tourism and maximal impact reducing the rate of transmission. And so I really think there needs to be more exploration and entertaining of alternative protocols instead of just shutting down the discussion about quarantine. And I think with some creativity, we might be able to come up with a better combination that allows visitors to truly safely be here in Hawaii.
Yeah, that's, I think, part of the frustration from a lot of our people in elected office and in positions that may sit around the table, that they don't have that opportunity because it's set in stone. We're not going to inconvenience the visitors by a quarantine. We're not going to inconvenience the visitors by charging them for a second test. We are not going to do that. So if you have a recommendation, it has to be in line with what we want, which is total flexibility for the visitors. And we will demand that our residents be confined to quarters, stay away from gatherings, yet at the same time allow our beaches to be filled with visitors. And understand it's a little safer out there in the open, but I think the residents are getting frustrated because it seems like our freedoms are taken away, or we're being asked to really sacrifice while the tourists roam free. And I think that's kind of what the underlying feeling is throughout the state. And I think it's a bad thing. I don't think it's good. It's not going to be good for tourists. It's not going to be good for locals. So let me ask this as we wind down. Let's just assume that each of you are on a table that are going to make recommendations to state leadership. Not that you will make the decision, but you are part of this roundtable discussion of where do we go from here, considering variants, considering vaccinations. I know the governor tonight on the news said he's encouraging everyone to get vaccinated. The problem is not everyone can get vaccinated. People are begging to get vaccinated and they can't get vaccinated. So understanding the limits, what would your recommendation be, Dr. Evslin? What would your recommendation be going forward?
Well, I'd like to, let's just talk just for a few minutes just about the vaccinations themselves and then come to a recommendation, if you don't mind.
Absolutely.
I think somewhere between 50 and 60 million of the vaccines have been given out in the US now, I believe. Anyway, the number is something like that. Most of those were the Moderna and Pfizer vaccines because Johnson & Johnson has just kind of come in. And so the safety record seems to be extremely good. That the severe anaphylaxis that they're worried about appears to be about somewhere between 2.5 to maybe 4 per million people could have a severe allergic reaction, and it's reversible with medication. But that's a pretty good number. 2.5 per million makes you pretty safe in terms of anaphylaxis. So the vaccines appear to be very safe. And there were actually 4 stories that were interesting to me on Monday. The 4th story was the CDC came out with a report. We couldn't actually see the study, but the report was they followed a very large number, I think maybe 44,000, Lee, correct me if I'm wrong on that, but they followed a very large number of healthcare workers who had the shots, Moderna and Pfizer, and a few had Johnson & Johnson. And what they were interested in is not how many had symptoms after the shot, but how many actually had an evidence of infection because they were doing these nasal swabs on them. And 90% effectiveness in terms of not having the disease. And just to explain this a little bit, what they knew with the first studies for Johnson & Johnson and for Moderna and Pfizer is that 95% of people who got the shot did not have even mild evidence of illness. So they didn't have symptoms, but they didn't actually know if they were infected because they weren't culturing, they weren't testing all those people. They were looking for symptoms. So what they found was this great effectiveness that 95% did not have symptoms and 100% did not enter the hospital or die. And that was fantastic results for Pfizer and Moderna. And then there was the question of safety because it's a new vaccine, a new type of vaccine with this messenger RNA. But the fact that this many millions of dosages have now gone in the US and they're seeing safety across the board, and that the numbers of severe allergic reactions are such a low number, even though we look for them. When we immunize, we're saying you have a history of allergic reactions, and we're watching you closely and so on, but the number is really small. So that messenger RNA type of vaccine is a huge breakthrough and seems to be very safe and seems to really work well. The other good news is after, it's 2 shots, each of those, 3 weeks for Pfizer and 4 weeks for Moderna, it appears that 50 to 80% decrease in showing symptoms of disease even after the first shot. So 2 weeks after the first shot, somewhere between 50 to 80% decrease in having the disease. And then 2 weeks after the second shot, 95% decrease in having symptoms of the disease and 90% decrease in having the disease at all, which was a question that was hanging out there. Okay, we know you don't have symptoms, but are you actually catching the disease and being asymptomatic? So the fact that these were all test negative, 90% of them, is a great piece of news. Now, these other news that 100 cases were in Seattle and so on after 2 weeks out of the test, that's evidence that we have to keep watching. 90% isn't 100%. So 10 out of each 100 that get vaccinated could show signs of, could have the disease. So that's not unexpected, but we're going to need to keep watching that. But those numbers are very reassuring. How many people have gotten the vaccine, how safe the vaccine appears to be, and how amazingly effective these 2 first vaccines are. The Johnson & Johnson vaccine, which doesn't have quite as good numbers, still has, I believe, 100% decrease in severe illness or death. So if you got that vaccine, you're still not going to have severe illness or death, at least in the studies they've done. It has some decrease in effectiveness, meaning 65%, I think, didn't have any symptoms at all only, but that's still a really good number. And the advantage of the Johnson & Johnson vaccine, it's only a single shot, doesn't require the refrigeration that the other 2 do. It's probably going to be widespread around the world. And even 65% having no symptoms virtually after the shot is still a good number. And 85%, it had 85% effectiveness in terms of severe to moderately severe disease. Lee, correct me on those numbers if I'm correct.
That's what I remember.
Yeah, but Johnson & Johnson still is very effective, even though it doesn't quite have the numbers that the Moderna and the Pfizer have. So that's really good news. And my wife and I got my shots because I was working in the immunization clinic, and it's great to have your shot. You just, not that I'm not careful, not that I don't wear my mask carefully when I go out, but it feels wonderful to have your shot in and to be able to play with grandchildren without any really discomfort of apprehension about what's going to go on. So from a personal level, it's wonderful having the shot, and from a statistical level, the evidence seems to be very strong that these are very safe and extremely effective.
Dr. Lee Altenberg.
So, so my research focuses on evolution, and we're seeing with the variants, we're seeing evolution in real time. And the thing is, all right, we've got these vaccines, they work on the old variants, but the coronavirus is trying to seep into our bodies by any exit, any entrance way that it can find, to be metaphorical. And it continues to evolve. And a recent survey, a worldwide survey of epidemiologists found that most of them think that within a year, there's going to be a variant of the coronavirus that evolves that renders our current vaccines useless, right? And about a third of them thought it would happen by December. So this is why we can't just say, oh, we're POW. I remember once seeing a sunrise at Haleakala, and there was a huge crowd gathered there, and you're seeing the sky glow, and suddenly, boop, up comes the sun, and like within 30 seconds, everybody was gone, right? The sunrise was just beginning at that point. And so the coronavirus is not just, we got the vaccine and boop, it's done. It's going to keep evolving, and much of the world has access to no vaccines. And so I would say for those who get the vaccine, the best way to evolve variants that resist the vaccine is to have people that are vaccinated exposed to the coronavirus. That's why you should keep wearing your mask, even if you've been vaccinated, even though your risk of getting it is way lower, 90% lower. You don't want to be the person that gives rise to the vaccine resistant variant. And so that's why you want to protect yourself from exposure until our numbers are really low. So we won't be done with this virus for months, and that's why we need to retain the ability to respond with quarantine or other emergency measures. And that's why I think we need to get better, evolve better protocols. I mean, develop better protocols, and watch what happens. I think the big danger time is going to be over the next 2 months, because we still don't have we still don't have herd immunity, the level of vaccination that you need to really stop the virus. So, so everybody be careful, and I'd say watch out for minimization. Probe your leadership. Be skeptical. That's how I discovered the Lancet study, because that headline said 90% elimination of infected travelers. And I said, this doesn't make sense based on any of the other science I know. And lo and behold, when I read the details of the study, it was because it was an incorrect statement of the results. So keep your skepticism up and do research. There's lots of information, and the kind of job that Mel and Charlie have been doing on this show is a great public good, a great public resource, and I commend you for it, and I thank you for having us on.
Thank you.
Thank you, Doc. Appreciate that. Yeah, when we first started, we would get I would get emails from Hawaii News Now or KITV, and they would ask for the permission to use our clips of our video, but that all stopped. It really seems like the media has chosen to follow the road of minimization. So they don't want to put up clips like tonight's clips. I think, and it's frustrating because Charlie and I and our viewers have seen, and listen, we're not cherry picking our guests. We have put out the invitation to anyone, whether they have opposing views or not. We just can't find anybody that agrees with leadership in that are experts. We can't find them. Charlie and I have tried looking under rocks. They don't exist. So, we appreciate you guys taking the time to come on. Did you have any closing thoughts before we I know the vaccine. I'm finally getting my shot on Monday. Finally, I had, because of prior reactions to vaccinations early on, many years ago, my doctor wanted me to wait. And she gave me the green light, so I got my okay. So I'm getting my shots on Monday. So I'm excited. It'll be I'll be happy when it's done. But any closing thoughts before we head out, Doctor? I was gonna say Dr. Lee, Dr. Evslin.
No, I agree with Lee Altenberg. Immunizations are vital. Watching the data is vital, and flexibility is vital. And that does mean that that bill in the House is so ill-considered that they would take the flexibility away from the governor and the mayor and give it to our legislative bodies. That is really ridiculous. But come in and get in line for your immunization. They're rolling them out as quickly as they can, and I give enormous credit to the people, all of the organizations giving the immunizations. The hospitals are running great systems. The Department of Health is running great systems. 600 or so people will come through in the morning at the War Memorial Convention Center. It's smooth, it's happy, everybody's in a great mood. It's something to see how well that effort is going out there. So get immunized, be careful. We have 2 months, maybe more. If we lose the battle, it's going to be much more than 2 months, but the next 2 months are vital, and we can't let down our guard, and we need to watch closely. And if Safe Travels does the wrong things because the variants are taking over, we just have to be nimble and respond to it rapidly.
Thank you, sir. Dr. Altenberg.
Well, returning to the evolution, in France, a couple of weeks ago, they found a variant that wasn't even detected by the PCR test. So there was 8 cases of it, and they all died. So the variants, the virus can evolve devious variants, and we shouldn't be complacent. So we're not out of the woods yet. So let's not be complacent.
Thank you, Charles.
Well, as always, I'd like to say thank you to our esteemed guests. I've been looking at this one mutation of concern that, what is that? The 484K, the E484K, which is known as the escape mutation. And, as I read up on it, all I saw was it allows, whatever piggybacks on it to get past the body's immune defenses. I said, gee whiz, what more luck can we get when you got something like this floating around? But I just want our viewers to know that again, we bring on the information, and you folks can do whatever you want. Tonight was very, very impressive. But the one question that's been popping out throughout tonight's feed has been about the vaccine passports. I don't know how effective that can be. It sounds great, but like both of you said, you take away some safety measures, then how good is that? If you need to stop something, you don't take away the safety measure that was designed to stop the bad from coming in. You don't take that away. So I equate that to, like Australia. Every beach you go to, you see a big net. It's a false sense of security. Why? The net is put up in the swimming area so to keep the great whites out and let people swim. But nobody has ever gone in the water to look if below the surface of the water, if those nets got big holes. And if you saw that it had big holes, I can guarantee you wouldn't go in that area to go swim, because you got a false sense of security floating at the top. So I just want everybody to be careful, continue to wear your mask, continue to social distance, and just be safe, because until the final bell rings and they say we're all clear, then at that point we're clear, but we're not clear yet. So we just have to continually take precaution, and just think about the net. You can see the top, don't get that false sense of security. Just know what's below the surface of the water, because you might have big holes there, and that might be your danger point. Mel?
Thank you, Charles. Thank you. Thank you, Dr. Lee and Dr. Lee. One of our best shows, I think, based on the comments that I'm reading. Very, very satisfied viewers. Just a couple of things. Number one, I did want to address Senate Bill 266 that would take away the powers from the mayors and the governor for anything going forward. Guys, that's a very dangerous bill. I was disturbed to read here on Kauai, our Representative Tokioka voted against it, but our Representative Morikawa and Nakamura both supported it. So if they're your representatives, please, that's your homework assignment. Whether you're on Kauai or any island, you write to your representatives, your senators, tell them to please, please do not let that pass. The second thing is your vaccinations, please, if it's available, we'll get it. We got to get everybody, as many people vaccinated as possible. And then just don't be complacent. I think that was the message tonight. Don't listen to the gibberish. Don't listen to the morning news. Don't listen to Lieutenant Governor Green try to convince you that everything is all groovy. I was very happy to hear the governor tonight said that he's not ready to make any changes in safe travels until he gets confirmation from the science. He doesn't expect that to happen anytime before the end of the year. So we got some time. And I think we all got to be cognizant, as Dr. Evslin said, in the next couple of months, that's going to be the crucial period for us, especially here on Kauai with safe travels opening up on Monday. So with that, again, Doc and Doc, thank you so much. You guys are amazing, very informative. We appreciate you guys. To our viewers, thank you again for joining us and sharing your evening with us. We'll be back on Friday night, 7 o'clock, Feel Good Friday. Looking forward to seeing you guys there. All right, everybody stay safe. God bless. We love you all.
Thank you. Thank you.
Aloha.
Aloha.
Thanks for
Thank
having
you.
us.